Okay, great. Anyways, well, welcome everybody. And now that little delay, we have more people here now. So that's great. Welcome this evening. I'm Dana DeMaster, the current board president of Fort Road Federation. And this meeting tonight came out of, we've been doing a lot of engagement around Freedom House and some changes in the neighborhood over the last year or so, starting off last November. And in July, we had an in-person meeting, and Tanya was saying that this is a record number. I think that one, other than some annual meetings, pretty much took the cake that I've ever been at, with 70 people talking about Freedom House and some of the potential changes to zoning. But a lot of people at that meeting had questions about homelessness in general, and just like, who is helping people, and who are the different players, and how do I get involved, and how do people end up homeless, and what are these camps? And there's a lot of just general questions. So one of the things we said at that larger meeting back at Palace in July was we'll have an information night, bringing together the people who work with people who are experiencing homelessness, and to provide answers to those questions. So I'd like to welcome, we have quite the panel tonight. Travis Bistido with the Department of Safety and Inspections will give us a kickoff here, kind of giving how the various organizations work together, and that higher overview of the many people involved in addressing homelessness in our community. We have Megan from Radius Health, Molly from Listening House, Wendy from Catholic Charities, Andrea from the Safe Space, Senior Commander Ellison from the St. Paul Police, and Councilperson Nager. And they'll each speak we have like 15-20 minutes of them kind of giving us some information, and the remainder of time will just be for questions. And so I will moderate that when we get to that point. So I will turn it over to Travis Bistido to kind of give us that broad overview.
Thanks, Dana. Good evening, everybody. Travis Bistido, Deputy Director for the Department of Safety and Inspections. And you might wonder how we are involved. One of the divisions that I'm responsible for, code enforcement, has historically managed our unsheltered community in St. Paul for forever. And we continue to be involved in that work on a really a daily basis. And I should kind of frame this up a little bit. What I'm going to talk about is unsheltered homelessness, not the whole wide world of homelessness or people experiencing homelessness generally. So it's much more than that. Can you guys still hear me? I had a frozen screen for a sec. Okay, good. So a year ago, the city was experiencing really a crisis in this work. We had about 380 folks that were living in encampments at that time. Prior to the pandemic, the greatest number that we had experienced was about 26 individuals. That was our peak at any given time in the preceding couple of years. So 380 was a whole new world for us to work with in the unsheltered environment. And where did these folks come from? Again, I'm not an expert in this work, and we've just been trying to kind of keep our head above water and working to serve those folks as best as we can. But where we think most of those folks came from was shelters being depopulated as a result of the pandemic. So Catholic Charities, Safe Space, those folks were forced to depopulate in order to meet social distancing guidelines. And that resulted in a lot of folks heading out into the street, or at least that's our opinion. Individuals that were doubling up with friends or relatives, couch surfing, things like that. Some of those resources dried up for those individuals as well. And we saw, and I know we talked to a number of people that were staying at a relative's house, and they no longer were welcome there once the pandemic hit. And then the governor passed a number of executive orders last year, one of which prohibited cities from closing encampments unless there was a very clear and explicit hazard specific to that particular encampment. So we, the city, really kind of backed off in our normal work practices. We learned a ton through that experience, but we really shifted into kind of a supporting an encampment type role. So rather than closing encampments, we were providing porta potties. We were coordinating food service and other services to those individual encampments. Fast forward to last winter, we started seeing a variety of problematic behavior. Probably the most concerning was the frequency of fires and explosions that were occurring at the encampments. Unfortunately, we had a number of fatalities that occurred within the encampments last fall and winter. And the city made the determination that we just couldn't support folks that were in the encampment environment long term, and that no encampment is safe in the city of St. Paul. So we kind of shifted gears, and rather than trying to support people in encampments, we really tried to step into that work and learn from that crisis that we were facing, and transition people into the shelter space that Ramsey County had provided. So rather than quickly closing encampments like we were doing previously, rather than supporting the encampments during the initial throes of the pandemic, we really started closing encampments, but doing so and trying to be as thoughtful and as diligent and providing individualized solutions for the occupants of that encampment to plug them into the ecosystem of shelter space and resources that are out there, and close those encampments in a systematic way. So where that's left us now, as we were at 380 folks that were outside last summer. As of today's Thursday, yesterday, we were at 21 individuals. Now those are folks that we're tracking through kind of receiving complaints, and folks that we're visiting with when we respond to those complaints. The actual numbers are probably higher than 21, but it gives you some general benchmark of where we're at. Getting from 380 to 21, I think the city should take some credit for that work. It's certainly a new line of business that we've really tried to step into and learn from, and support our unsheltered residents. But a lot of that work goes through the coordination, or a lot of that success is due to the coordination of folks and agencies that are on this call. So while the city has made dozens of referrals to shelter and provided transportation and storage supports for those that choose to go inside, the bulk of that work is being done by our partnering agencies. So to get that work done, we meet a number of times per week and kind of triage at least the encampments that we're working with, triage those encampments and try to align those with services as best we can before we close them. And then also using that network of individuals to kind of bounce ideas off of and figure out how to do this work most effectively and to best support not only the city, but the residents themselves. And that list of folks includes a number of agencies on the call: Listening House, Freedom House, Radius, People Incorporated, Safe Space. We work with MnDOT and Ramsey County Sheriff's Department, obviously the St. Paul Police Department, St. Paul Fire Department. I should have written this list down before, but it's a whole host of government entities, agencies, nonprofits that we're all essentially trying to do the same thing, which is better serve those that are unsheltered in the city. And the successes that we've seen this year, although it's not perfect, is largely due to that collaboration. So hopefully I didn't go too far beyond 4 minutes, Dana.
Thank you, Travis. And now I want to welcome Megan, who is actually from People Incorporated, not Radius Health. I apologize for that mistake earlier, but welcome, Megan.
Hi, thank you. So I was asked to come to talk about street outreach, and the simplest way I like to explain outreach, because it can get kind of vague, is similar to taking case management outside. So we're trying to go to people and present resources and see what people need, see what people are interested in. Our approach is definitely getting to know people first. It's trying to find people in a space that they're able to think about beyond their next meal or being cold. So I mean, obviously a common thread is talking about housing. Other resources that we often talk about are like basic needs. I mean, obtaining clothes, warm enough clothes, medical needs, shelter, identification. There's definitely hoops to go through before housing is available to people. Talking about those steps, educating people about those steps, mental health concerns, connecting people with insurance. We try to go above and beyond that and look at it holistically too. I mean, just not have necessarily focusing on survival. I mean, some people have lived outside for a long time and, are used to living outside, and maybe housing isn't their first concern. Maybe living inside isn't a concern, and there are other things at play that they're interested in. So we try to come alongside, just like other case management situations, and see what that person is interested in and how we can address it. We're certainly like well-versed in de-escalation practices and people-centered approaches. Crisis is not something that we're trying to live in, although, that's certainly something that we can respond to when we see it. But we're trying to help people get to the next step. And that's certainly when someone is available to see other, steps for themselves. And I wanted to point out an example, like something that I just talked to someone with. They were interested in being able to speak more eloquently, like doing, public speaking, being more comfortable speaking. So we connected them with a speech pathologist. So just a variety of things like that. Our agencies try to be stocked with basic needs, temporary shelter if someone needs it, sleeping bags if people need it, socks. I have gone through a lot of socks this summer. Clean socks is important in the summertime. Sunscreen, Band-Aids, most of us carry Narcan in case something more drastic comes up. So we are, well-versed in the shelter system. We're connecting shelter a lot of the time. Housing is not something that is a fast process. I think I was told today that there's about 1,000 people on the housing list right now. I can tell you that I have roughly 15 clients that live outside, just myself, and I'm one of 15-ish street workers that I know, street outreach workers that I know. I think I covered enough. Thank you for having me.
I'm on mute. Thank you, Megan, very much. And next we have Molly from Listening House.
Hi, thanks for having me. So I'm Molly. I'm the executive director for Listening House, and we oversee the services at Freedom House as well. I know Freedom House and Listening House get talked about as that they're different things and they're different places, but it's all Listening House. And we're really grateful to have had the opportunity to expand what we do in trying to respond to the need that was presented during COVID. We're busy, so there was a gap that needed filling. So we're a day shelter, right? So we are providing triage services, the most basic of human needs: a bathroom, a chair to sit down in, food, some personal hygiene items, a phone, Wi-Fi, conversation, trying to be kind of an unburnable bridge relationship-wise to really build trust. We're also space for other people on this call. I see Megan probably twice a week because we have space for her to meet with her caseload. And it's not just Megan, right? As she said, there are many other workers and then also different clinics. We really try to link and bring in these external agencies because they're the experts at what they do. We don't need to try to replicate that. And people don't need 8 different providers in their lives. It works better if they have more one-on-one relationships. And so being able to provide those services that are consistent and they're there. Maybe it takes a month, but after a month, somebody says, who's Megan? What does she do? And we can go introduce. And sometimes that's just how it works. And then building on the relationships. I try to give examples as to what this sort of looks like, that unburnable bridge and that building of relationships and why that's really important. This wasn't too long ago, somebody came in who's pretty well known. I think other providers know this person. And she was just, anxiety was through the roof. Couldn't even speak. It was just yelling and crying and saying things that I couldn't quite track. And I was in the middle of many things. And it was sort of like all right, you got to calm down for a second, which is not the thing you say. I know this. But one of our, Nate, one of our managers said, hey, do you want an ice cream sandwich? And at that moment, they sat down, had ice cream sandwiches, and this client was fine for the rest of the night because he knew her. He knew exactly what was going on, what was the one-on-one attention that was needed. And so that could have been, without somebody who knew her, a 911 call, a trip to the hospital that probably wasn't needed. She just needed a little attention, and who doesn't like a little ice cream? And that's kind of a simple thing. However, it gets really big, really fast. And so being able to have that understanding of who people are is really helpful. And then also, as Megan said, housing is a really long process. And people can get really discouraged. And so part of also what we want to do is be as supportive as possible and try to encourage people, hey, let's try it again. You know, have you tried this place? We try to do a soft handoff. None of us are competing with each other. We all want to, hey, talk to this person, talk to this person. We try to make it as simple and smooth as possible to navigate and to try to not lose the motivation for doing it. If you get all the way through the housing process and then you get background screened in order to move in, and that felony you have from 5 years ago gets you out of there, it's really easy to say, I'm done, I'm not doing this anymore. And so to be with somebody along that process and say, I know it's hard, but I can name 10 people who are in your same position and they did get housing. Let's just stick with it. All those things are really helpful. So I can keep talking forever, as a lot of people on this call know, so I'm going to stop there.
Thank you, Molly. And next we have Wendy from Catholic Charities.
Hi, everyone. It's really great to be with you this evening. I'm Wendy Underwood. I lead the social justice advocacy and engagement for Catholic Charities of St. Paul and Minneapolis. I'm a very proud resident of the West 7th neighborhood and an even more proud recently retired member of the Fort Road Fed. So I'm proud of the crew for bringing us together this evening. I did attend the conversation in July that I thought was really something else too. So really proud of you. You know, I've been listening to people describe their work, and it's just so motivational. Molly is amazing. I could listen to you all day. I don't think you talk much. And then thinking about then how I provide the context of what we do at Catholic Charities. And I mean, and I know as good friends who worked hard on the new Dorothy Day campus on this call know, our organization is large. We have 16 sites across Minneapolis, St. Paul. We have larger congregate setting emergency shelters and housing locations in both cities. We serve children, and we are the only family, they're the largest family homeless shelter in Ramsey County, the largest youth shelter in Minneapolis. So I mean, you name it, we've got a big net. And so I will share specifically about the Dorothy Day campus, given kind of the organizers of this call, and I want to share what is on that campus. Every single person here is invited to join me on any day to spend time there to get a better sense of the space and of the people being served. If you had volunteered there in the past and haven't been back since the new campus opened, then I really strongly encourage you to come, because it is not just different in space, but the people we are serving have it in their challenges have greatly increased. And you know it. I mean, it doesn't take much to be able to tell that it's different. So the Dorothy Day campus is a one-of-a-kind model. I mean, to house emergency shelter and housing in one place is not common. And it is our belief that by providing access to every kind of resource, from that emergency, I need a safe place to go tonight, to the next day having access to a hot meal, a hot shower, a cell phone charger, and then conversations with caring, trained adults on how to begin the arduous, hard process of accessing services. For most folks, again, a lot of people we serve have tried to receive benefits in the past and just have reached a roadblock, and so our site hosts those services. We ourselves run the campus and then work with partners. Largely Ramsey County is meant to be our biggest partner on campus, to connect the people we're providing shelter and housing to those direct services. And the campus is such that it was built to support 280 emergency shelter guests a night. And then our across the street, our Opportunity Center, which opened just before the pandemic, that can serve at full capacity 350 people in one meal setting, which is very intentional. That's to be able to remove lines, take one less line out of a person's day and let people sit together, break bread, commune, catch their breath and connect, or just enjoy a quiet meal by themselves too. But so it is that big. And then that is the site that we have several different types of offices, services, and facilities for our partners, from foot care to hair washing and showers to Ramsey County Social Services. Also on campus then, we have 193 apartments and on the shelter side, the first side that opened, and 177 apartments that opened in late 2019. So all told, the campus had estimated supporting roughly 1,000 people a day between our permanent residents, our overnight shelter guests, and people just seeking a hot meal, that place to sit, and a shower, of storage for their clothes as they're on their way to work. The pandemic hit just, I mean, it felt like minutes after we had really truly opened the second phase of the campus, and we had to immediately convert services. Missing on this call tonight is representation from Ramsey County, which has invested mightily in temporary locations for vulnerable adults to be able to help with lowering the census so that congregate care settings would become less vulnerable. And I'm extremely proud to say, even to this day, even with the Delta variant, among our single adult programs at Catholic Charities, we have a 1% COVID positive rate. And I was saying that before Delta, and we've had a number of testing events very recently, and those are sleepless nights, worrying about what's going on. And so the fact that what we're doing and what our partners are doing has been working, you cannot be taken for granted. But so I will say what Dorothy Day was built for, it has not lived to that potential. Ramsey County did not move in. There's a couple people that show up on Wednesdays to help with financial services, but that's only been recently. There is not direct access to benefits and social services happening because of the pandemic and Oregon people working from home. So we have kept people alive. We've kept people safe. and we are anxious for to turn that bend so that we can be getting, so that the campus can really be doing what it was built to do. And we have just today, my new CEO and Commissioner McDonough and leadership were on the phone, like really hammering out how we're going to get there. So I could go on forever too, but I strongly encourage anyone on the call to come spend time with me at Dorothy Day. I'm at home now, but my office is right there on Old 6th Street at the Office for Social Justice. I strongly encourage people to visit Molly or Sarah at Freedom House if you haven't, or, you know, I'll volunteer Megan to like have a visitor come along, because it just really super helps. You don't have to spend much time at all to see how things are today, which are much harder than they were just a few years ago.
Thank you, Wendy. We have a couple more speakers, and then I want to open it up for questions that people may have. Next, I want to welcome Andrea from this I keep calling it Winter Safe Space because it used to be called that, but it's just Safe Space now because it's all year round. But welcome, Andrea.
Hi, thank you. I need to apologize. My old house hates the internet and this dog has like an identity crisis. So there's a lot going on here at home. Doing my best. Thank you so much for the invitation. I am the manager of Safe Space. We are a Model Cities run program. So we have the contract through the county. Model Cities is a 52-year-old, going to be 53 this year, organization here in past years in transitional housing for families coming directly out of homelessness, house, when Winter Safe Space was transitioning at the county's request into a year-long shelter, Kizzy, the executive director, heard the crickets in the room and realized that this was where Model Cities needed to expand and grow their vision. So here we are. Everyone is frozen on my screen, so I'm not really sure if you can hear me. Hopefully you can. Okay. Thank you. I'll shut my camera off if that happens again. We're a 64-bed shelter. Typically we have 50 men and 14 women. It's a little fluid. We can increase our women to about 20. That is something that we are constantly watching as their women's beds. 14 beds are not a lot left over for women in crisis in the middle of the night in need of emergency, of an emergency spot. So we're watching that. Okay. It's probably okay that we are 7 nights a week.
Andrea, do you want to try turning your camera off? I think she's frozen. I will chat her and let her know so we can come back to her. But in the meantime, Senior Commander Ellison, did you want to tell us about the police response, the police involvement? And I will message Andrea there.
Sounds good. Good evening, everybody. Thank you for the opportunity to be here tonight. My name is Jeremy Ellison, and I'm the Senior Commander for the Central District for the St. Paul Police Department. Central District encompasses West 7th Street, downtown, the North End, and the West Side. The St. Paul Police Department works in collaboration with all of the partners on this call today. Much of the work that we're doing with our unsheltered residents actually doesn't involve police work as far as arresting people. In fact, our department has been very thoughtful about our work. With a goal of trying not to criminalize homelessness. Many of our contacts are positive, and our officers are oftentimes offering services, making referrals to the different shelter and service options. So one of the things that we have seen, and one of the things that we do sometimes end up making arrests for, are times when predators come into the areas where our unsheltered residents are spending time. They take advantage of them by selling them drugs and perpetrating other criminal activity. We've been focusing on that in various areas. when that occurs. But again, that's a pretty small percentage of the time. A lot of our activity is really spent making positive contacts and just being visible, getting out of our cars, walking around and talking to folks. So St. Paul PD has been very fortunate this year, as well as last year, the end of last year, to have the support of the mayor's office, specifically Deputy Mayor Tincher, as well as Council Member Naker, which has allowed us to have extra police resources dedicated to these areas where we were seeing the most need. These extra overtime officers are able to focus on addressing specific problems in those areas, and it's all part of a plan that we call our area action plans. We've seen huge success by implementing these plans. Very appreciative of the support that we have from all of our partners in this work. We wouldn't be successful without everybody working together. And I know it's been mentioned by several on the call, but we really are all working together. I feel like St. Paul is a very unique, has done a great job in the leadership of our city, and has really done a good job of bringing everybody together so that we're all moving forward in the same direction and working collaboratively. So again, thanks for the opportunity to be here tonight, and look forward to questions later.
Thank you. I see that Andrea is back.
I moved outside of all places. I don't know how that works. I'll just be quick. 64 beds, 50 men, 14 women, 7 nights a week, 10 p.m. to 9:30 a.m. if you sleep overnight. If you didn't spend the night with us because congregate settings aren't your thing, and you have a lack of trust or discomfort level, you can show up at our door between 9 and noon, get a shower, a set of clothing, just a space to yourself for a moment. Even if you've been restricted from us, 9 times out of 10, you've been restricted because a congregate setting does not bring out the best in you. But when you are one-on-one and we can offer you just a little bit of quiet and your own space, you do well. And we can build trust and build relationship and try to move forward from there. We have long-term storage. A lot of these extras are thanks to Travis coming to us and saying, hey, what can you do? Because he's working so hard to figure out how folks can transition from the encampment and not be afraid to lose their things, or have a spot to crash if in the middle of the night they decide I'm done camping or I'm not safe and I need to go somewhere where I've built a little bit of rapport and I can show up at 3:30 in the morning and say I'm ready, right? And so because of our community partners, we've been able to offer that. We are pretty bare bones. COVID did kind of encourage us to expand outside of our wheelhouse just a little bit. We offer more clothing than we ever intended. We offer more food than we thought we might. But one of the great things about Model Cities, being a small organization, being a small shelter, we've been able to pivot pretty quickly as the needs have changed, as we've needed to adapt to the community's requests. So I'm really proud of Safe Space for that. But mostly I feel like we have become kind of a center point of communication and connection for service providers. So we do have outreach come several mornings a week to meet with our folks. We have Clinic 555 come in once a week, HIV, AIDS, hepatitis testing, education on safe sexual hygiene. We have Minnesota Community Care come in once a week with a nurse for any type of basic wound care or prescription refills, those kind of things. And we have Streetworks come in now as our youth population has been growing. And in the shelter world, that's about 18 to 24. So we see a lot of increase in the 19 to 22-year-olds. So they have begun to come once a week as well. And basically our motto is come in and sleep. Nothing ever gets solved after dark. This is actually what I tell my children to just get a good night's rest. Like that is the foundation. In the morning, we can problem solve. Like that's when the office is open. That's when the people that you need to talk to are going to be available to you. So like, let's just get you that good night's rest, like that first step. And then we do our best to break some sort of pattern so that the next day is not the same as the day before. And that's because we've moved just a little bit out of what hasn't been working. And that's Safe Space in a nutshell.
Thank you, Andrea. And last but not least, before we get to questions, we have Councilperson Naker to tell about some of the city's policies and things happening at that level.
Thanks so much, Dana, and thanks to the West 7th Fort Road Federation for hosting tonight. I know I'm all that is standing between you and Q&A, so I will be brief, but I guess first of all, I just want to say I hope that if there's only one thing that you take away from listening tonight, it's that addressing homelessness really is a top priority for all of us on this call and for so many other very thoughtful, hardworking people at the city, at the county, at our nonprofit partners. And to the extent that we are not succeeding in addressing the problem to the extent that we would like to, it's not for lack of wanting to or trying, it's because it's an extremely complex problem that wasn't created overnight and won't go away that way either. So I guess I just want to say that at the outset. I was asked to talk about policy changes that might be coming down the pike related to homelessness. And there are two policy buckets in which the city council plays a role when it comes to homelessness. One of them is creating more housing, right? So it was said twice tonight by Megan and by Molly that finding housing is a really, really long process. And that's absolutely true. And it shouldn't be that way. There's a bottleneck in the supply. And part of our role, I think probably our primary role as a city, is to make it possible to build more housing and more affordable housing. So there are a couple of policy changes that we're working on in that regard. One of them is the homeless services zoning study, which we just talked about, which is more on the services side rather than supply, but to allow these kinds of day spaces that give people access to housing to be located in more parts of our city. We just removed parking minimums citywide. That may not seem like a direct connection to housing, but it lowers the cost of building new housing dramatically. And so getting rid of parking minimums is huge. We are currently studying our 1 to 4 unit housing citywide to try to see if we can increase density, so to allow more homes to be built in an already fully built city. And we're also studying inclusionary zoning, which would require affordable housing to be built as part of any market rate development. So, and there's a lot of different iterations of how all of those policies could take shape, but those are some of the ones we're looking at. I would also say we are dedicating a lot of dollars to building more housing. So the Ramsey County just initiated for the first time ever a housing and redevelopment authority levy. So they have never enacted that levy before, and that is all going to go to building affordable housing. Both the city and the county have said we're going to dedicate significant amounts of our American Rescue Plan dollars to housing, shelter, affordable housing. So money is part of the equation as well. And I'm glad that Wendy mentioned Ramsey County because they really are equal to, or I would say even above the city in terms of responsibility for, budget for, and activity when it comes to homelessness. And then the second kind of bucket of policy is just better responses when people are already experiencing homelessness. So we create as much housing as we can, but then when people experience homelessness, we want to respond as effectively as possible. So Deputy Mayor Tincher and I are working on creating a rapid response team. So you can call someone who is not 911 if it's not a 911 type of situation. Commander Ellison and his team do an incredible job bringing sensitivity and understanding and empathy to these situations. But sometimes the best call is to someone who can spend a lot of time really working with someone in crisis. And that's not always the right call to 911. So we're working on creating a rapid response team for that. Also a place to bring people who are in crisis where they can actually spend some time, not jail, not the emergency room. Those are revolving doors. So creating a better long-term place where people can just be brought to and have the chance to process what's happened and actually get real help that's meant for them. And then finally, we are part of the Heading Home Ramsey Consortium, on which many of the folks on this call are part of that. And that's a place where we coordinate our work. We make sure we all know what each other are doing. We track data over time. So we're paying attention to this problem. Sometimes I get asked by constituents, what are you doing about homelessness? Do you even know that this is a problem? And I think Heading Home Ramsey is the place I always point to say, yes, there's a lot of thoughtful people aware of this problem, looking at it, tracking it, and devising solutions to address it. So I think I will stop there and look forward to the Q&A.
Thank you so much, Councilperson Naker. Okay, and for the Q&A, I see that we have some people who are calling in on their phones and others who are on the screen. And so let me first give the people who are on the